Hey, everybody. All right. Thanks for joining me tonight. I know we normally do Sundays, but today was a special day because I came across some information and I want to share with you. Um, I suffer from trigeminal neuralgia. It is basically the fifth cranial nerve that is being affected. Um, it sends staving. One of the downsides is it sends stabbing, electrifying pain all down the course of the left side of my face. One of the reasons why my face, my smile is off, my talk is off, has a lot to do with this. Um, the cause of it has to do with the fact that I have MS. I have multiple sclerosis. I was diagnosed with MS 2000. I'm sorry, excuse me, 98. And this has been happening off and on for me, the trigeminal neuralgia, for quite some time. It's just as I got older, and you can look it up, as you get older, it gets worse. And I have been dealing with it with taking medication. One of the medications that I'm taking, that I have been taking, excuse me, that I'm not taking anymore, it's called carbamazepine. And basically, carbamazepine is an anti-seizure medication. So yeah, it worked, but it just put me to sleep all the time. So I got my work done, but right after I got my work done, I go to sleep. So it really didn't do much good for me. Um, but if it was a blessing, I guess that's what it was. Um, I've been dealing with this back since I was in New York. Yeah, but when I moved to Texas, it was brought on a lot stronger to the point where it is so debilitating. It lasts 2 minutes for me anyway. It lasts 2 minutes, but I tell you, it is the worst 2 minutes that I, as a man, have ever experienced. They say there's only two comparisons: pregnancy and this right here. This trigeminal neuralgia has been labeled the suicide pain because people have tried to take their lives over this pain. The video I have today to show you guys speaks a lot more in depth about it, how what causes it, what treatments are, because there's no cure for it. But the treatments that they have now, like for instance, what I had something called a radio ablation. Basically, they did my nerve ends and my nerve endings, and that works. That worked for me. The first one I got was 3 years ago, and the second one I got was about 2 months ago. So it's been working for me, and I'm extremely happy. I'm extremely happy about it. Only thing I'm not happy about is how it how it makes my face look. But you know what? I'll deal with that rather than dealing with that other pain. And this will be taken care of by Botox. Yeah, I'm gonna get Botox shots. So basically, what this is what's happening is that being that the nerve endings were deadened, everything is tight. So it looks like I'm giving a weird smile, or um, like I'm playing a Joker or something like that. But for a lot of years, I didn't really go out in public too much. As this got worse, I really didn't go out in public too much. I really didn't do too much family things, or if I did have to be on camera or go see family, I wouldn't be right up on them. And if you ever notice, like any of my other videos that I've ever done, I'm sitting at this desk And I usually have this microphone in front of me, and I'll have the filter covering my face. And that's the reason why. But it comes a time where I feel that somebody out there is also going through this same issue, and they don't have an answer for it. They have never been given an answer for it because doctors are still learning about this. So if I can help in any way, I'm here. Listen, let's take a look at the video.
I would compare this pain. I mean, there is no comparison. This pain is so intense and so painful that it can't compare to any other pain I've ever had. I've had ankylosing spondylitis, rheumatoid arthritis of the spine since an early age. I went through a lot of pain and back pain with that. It doesn't compare with this pain. This pain is so intense that it'll drive you to your knees.
If I brush my teeth, there could be, even on the amounts of those pharmaceuticals I'm on now, there could be, there frequently are, little jolts of electricity if I try to brush my teeth. So on the upper right-hand side of my face, I just don't brush my teeth, scarcely at all. Using a very small-sized child's soft toothbrush helps, but I just get very frightened that with the little jolts of pain, they could intensify because they could be warning pains of a large episode starting. Very similar things of trigger points, sometimes just of cold air brushing across my face, sometimes applying makeup to that side of my face, a kiss, sucking through a straw. Those kind of small jolts of electricity now make me very fearful of a large episode.
Trigeminal neuralgia is frequently described as one of the most painful afflictions known to man. It is a sharp, stabbing pain that involves one side of the face. It typically comes on spontaneously in middle age or in the older years of life. It is usually brought on by or exacerbated by touching the face, by eating, or by chewing. And very, very typically, it is relieved completely, at least in the early stages, by a drug called carbamazepine. If that drug, also known as Tegretol, does not relieve the pain, there's a good chance we're not dealing with trigeminal neuralgia.
Well, the dentist, what he did was he x-rayed my teeth. He didn't see anything wrong. And I continued to go back to him with pain. And then his final thing for doing anything on that side was a root canal on my right side front tooth at that time. What I thought about it was, I thought, this root canal is not working. And he said that being a front tooth, it may take a little while for it to totally, deaden.
A dentist could do nothing for me. From that point, I went to several other ENT specialists, ear, nose, and throat. I even tried remedies on my own, going to a chiropractor and to an acupuncturist, anything to relieve the pain.
I thought it was perhaps a dental condition because the teeth in the upper right-hand side of my mouth, especially the back ones, felt this intense heat. So I thought perhaps it was a dental condition. And my dentist or an oral surgeon, neither one could relate it to any kind of dental problem, and recommended that I see this particular doctor who specialized in TMJ. This was in Amarillo, Texas. Well, this man told me it just wasn't TMJ and he didn't know what it was, and goodbye now, please.
Trigeminal neuralgia is not infrequently misdiagnosed in its early stages. And I think the most frequent confusion is over whether it's a dental disorder. We see a number of patients who have multiple teeth pulled or multiple root canals before the dentist finally realizes that dental work is not going to solve the problem. That's probably the most frequent misdiagnosis. Well, the diagnosis of trigeminal neuralgia is different than almost anything else we diagnose in neurosurgery, in that the physical examination is almost always normal, and imaging like MRI scans or CAT scans are also normal. So we make the diagnosis solely based, in most cases, on the patient's description of the pain. The characteristic description that we look for is pain on one side of the face that is described as sharp, stabbing, or electrical. Pain that is brought on by touching the face or by eating or chewing, we call that a trigger point. And pain that is relieved, at least in the early stages, by a drug called carbamazepine. If the patient relays that type of history, we can be very confident that the diagnosis of trigeminal neuralgia is correct and that the patient will be a good candidate for surgery. There are a number of surgical procedures that have been performed over the years for trigeminal neuralgia. Currently, we offer 3 at the University of Florida. For patients who are in good physical health and can tolerate general anesthesia, I believe the procedure of choice for trigeminal neuralgia is an operation called microvascular decompression. This was invented and popularized by a neurosurgeon by the name of Peter Janetta, who practiced for many years at the University of Pittsburgh. And this operation is now performed all over the world. It is done under general anesthesia. It involves making a small incision behind the ear on the side of the facial pain. We then remove an area of bone in that region that is slightly less than the size of a quarter. We open the covering of the brain, and using the operating microscope, we look directly at the trigeminal nerve as it comes out of the brainstem. And what we're looking for is an artery compressing and pulsating against that nerve. We believe that pulsation over a number of years wears down the lining of the nerve. We call that myelin. And when the myelin is worn off, the nerve short circuits so that normally innocuous stimuli, like touching the face, produce severe pain. If we find an artery and move it, and then insert a small pad to prevent the artery from coming back into contact with the nerve, the pain can be cured in the vast majority of cases without any facial numbness. That operation typically takes about 45 minutes, and most patients spend 2 nights in the hospital. They then spend a couple of weeks at home finishing their recuperation. That's the operation which we prefer to do whenever it's medically safe. If it's not medically safe because of extreme age or because of other medical conditions like heart disease, we prefer to do a simpler outpatient procedure called radiofrequency lesion. Radiofrequency lesion is again performed in the operating room, but we use a simple, quick-acting intravenous anesthetic to briefly put the patient to sleep, allowing us to painlessly insert a needle into the nerve. We then burn the nerve, and that will leave the patient with a feeling much like Novocaine in the area where they previously had pain. This operation typically takes about 15 minutes, and it's performed on an outpatient basis. It is very effective at relieving trigeminal neuralgia, but it has the drawback of facial numbness. And if the operation is successful, that facial numbness will be permanent. Most people like the facial numbness, at least they like it a lot more than the pain of trigeminal neuralgia. But some people don't like the numbness, and we call that anesthesia dolorosa, or painful numbness. So if we can do an operation that will not cause numbness, like the microvascular decompression, we prefer it. But if we don't have that option, radiofrequency lesion will get rid of the horrible pain of trigeminal neuralgia. The third procedure that we offer for trigeminal neuralgia is called radiosurgery. Radiosurgery is an outpatient procedure where we focus hundreds of very small beams of radiation on the trigeminal nerve through the intact skull. And that highly concentrated dose of radiation produces changes in the nerve and its lining that over the subsequent several months lead to pain relief in the majority of cases. There is less numbness after radiosurgery than after radiofrequency lesion. So some of our patients prefer to have radiosurgery as opposed to radiofrequency lesion if they're not a candidate for the first procedure, microvascular decompression. The biggest drawback of radiosurgery, the focused radiation treatment, is that it typically takes 6 to 8 weeks after the treatment before pain relief is achieved. So for patients who come in to see me with very, very severe pain, it's simply too long to wait, and we have to select something else. But for patients whose pain is reasonably controlled on medication, radiosurgery is a reasonable alternative. The most typical reaction that I get from a patient when I describe the surgical options is, "Can you do it today?" That's because this pain is so bad, and they typically have been treated so long with measures that are now ineffective, that they are quite literally desperate to have somebody do something to help them. Now, I think that must be tempered in some cases by understandable anxiety about going through surgery. And of course, we try to alleviate that as much as we possibly can by carefully describing exactly what we're going to do, the high success rate and the low risk of the procedure.
I met Dr. Friedman. He immediately gave me hope that this pain could go away. He explained everything to me, let me know the risks, but explained the benefits and the success rate, and made me feel very comfortable that this is what I want to do.
I'm thinking about how grateful I am that he was here and could help me. And I've learned that there's a lot of other people that's in my condition. And I'm just grateful, very grateful.
I have a great excitement about getting rid of this pain and not being afraid to brush my teeth or snuggle with a child or suck on a straw or kiss my husband or being alarmed that I can't speak at some engagement I have accepted the invitation to speak with. I am very, very excited and eager for Dr. Friedman to get me rid of this problem. And I think Dr. Friedman can do that he's done it many times for others. And I'm just excited to get rid of it. I want this procedure done, over with, and I want to be set free.
Well, I think that trigeminal neuralgia surgery is one of the most rewarding areas in all of neurosurgery because it is a very, very severe pain disorder that we can successfully relieve in the vast majority of cases. So patients and their families are usually very happy with the result of surgery, and that's what being a doctor and being a neurosurgeon is all about. Patients come to Gainesville from great distances to have their trigeminal neuralgia treated. And that's simply because at this point there aren't a lot of neurosurgeons who are actually actively involved in the treatment of trigeminal neuralgia. They tend to be confined to a few regional centers scattered throughout the country. In order to find out if there's a neurosurgeon near you who can provide you with experienced, successful treatment, you probably should consider contacting the Trigeminal Neuralgia Association. The national headquarters of the TNA is in Gainesville. They have a website, and they can provide you with excellent information about the diagnosis and treatment of your disease and about the availability of experts to help you, hopefully close to your home.
So, like I was saying, guys, you may know someone who's going through this, or you yourself may be even going through it. You're not alone. You're not alone. The pain is intense, but there is a fix for it. Not a cure, but a fix. So keep fighting, stay strong. If you have any questions, just leave a comment below. I'll talk to you soon. Thanks for joining me tonight.